Hello, my name is Dr. Shanda Blackman, and I'm a thoracic surgeon here at Mayo Clinic in Rochester, Minnesota. I'm also the medical director for the consumer digital platform within the Center for Digital Health. I work to provide the best care for my patients longitudinally. That means that as a surgeon, my care for my patients doesn't stop at the end of surgery. To meet this need, I started a long time ago and began to collect information about what patients care for. Focusing on patients with esophageal cancer, we developed the Upper Digestive Disease app. This is an app that is patient-centered, developed for patients to enable providers to give patients the highest level of care. Patients come into the clinic, have neoadjuvant treatment for their esophageal cancer, undergo complex esophageal reconstructive surgery, and eventually have been reconstructed and begin their survivorship. Survivorship care is a combination of longitudinal symptom management combined with cancer surveillance and targeted, focused intervention. Now, survivorship care sometimes includes the administration of adjuvant therapy. As we develop our survivorship care clinics, we are looking to give our patients the best digitally enabled, longitudinal, remote, virtual follow-up that an institution can deliver. That means we are utilizing the Upper Digestive Disease app. This app measures multiple different domains. Each domain represents a symptom or a phenotype of symptoms that help a provider to understand what is happening with that patient. For example, a particular patient may suffer with dumping, pain, reflux, heartburn, regurgitation, weight loss, fatigue, declining physical health overall, declining mental health overall, or a myriad of symptoms that we identify as pertinent to the care of that disease-focused group or pertinent to the group of symptoms that have been volunteered by patients as the things they care about most. This app started out by running a focus group many years ago in my early practice. We asked patients, what do they care about most? Year after year in a focus group and symptom support group that I ran during my early 8 years of clinical practice. During that time, we asked patients questions, we measured the frequency and the severity of the scores, and we developed a paper version of the questionnaire. The paper version of that questionnaire then was used to develop an app or a tool that would measure these domains. Sometimes the domains were only 1 or 2 questions, and sometimes 10 questions would relate to that domain. The scoring of the responses led us to get an overall domain score. That was extracted to go from a range of 0 to 100. We then set about looking at the scree plots and eigenvalues of those distributions of scores to make sure that they were measurable and accurate. Subsequently, we looked at this cohort and wanted to convey to them the severity of their scores. We met with experts and utilized a modified Angoff standard setting method, having experts tell us after looking at the questions, the scores, and the domains, how they thought patients should be characterized if they were managing them in the clinic. This gave us 3 color-coded scores, yellow, green, and red. The green color represents good, which means the patients are doing well, and any provider seeing them in clinic would only encourage the patient. The yellow score meant that the patients might need targeted education to help them to do better. They might need to be reevaluated after that intervention and made sure that they are moving back towards the green. Patients, however, who score in the red zone are targeted by experts to be those that need an intervention with a provider visit. We have carefully built out champion-based, expert-based models of care and care pathways to manage each domain when a patient measures in the red severe domain score. Those patients are then followed along the algorithm for how they are evaluated, what kind of diagnostic tests need to be done, and what kinds of experts they might need to be referred to based on their scores. This intervention is very carefully monitored by the survivorship care team, which will then offer the patient an intervention to get them back in the good or green zone. We will measure over time with the dashboard how patients do and whether they get back in the green zone as they are managed with or without a survivorship care team. The app is also available to patients to use on the App Store public without the Mayo Clinic specific patient education or targeted provider-based intervention. This free tool allows patients to self-monitor and self-intervene and share their scores with providers. This public version can be used as a metric for other institutions to validate the tool. The use of the tool within Mayo Clinic can then be used for analytics, AI interventions, and machine learning to create dashboards, pathways to better care, deeper analytic models that help us to have greater insight on how to manage each domain, how to tailor our surgery so that patients do better, and how to specifically serve the needs of our patients so that they have the best outcome longitudinally. This also allows all of our providers to practice at the top of their license, only intervening when their specific care is needed. The Survivorship Care Team longitudinal disease-based virtual digital care clinic will enable patients to be constantly monitored so that they are not lost over time. And then when they are identified to need an intervention that only Mayo Clinic can provide, or that Mayo Clinic provides best, we can bring those patients back to the institution in a physical way, allowing for them to get the care that they need that might only be able to be physically delivered, and then longitudinally follow up with them to ensure that they are doing well, measuring the result of our intervention and making sure that it improved their life. Making sure that we involve all of the complex teams that are involved in the care of the patient with esophageal cancer will be our first step. Subsequently, we may look to expand this to other disease groups like gastrectomy, pancreatectomy, bariatric surgery, other types of foregut problems like benign foregut with reflux or achalasia. Once we have completed expansion of the app for all foregut disease, our goal will then be to expand it perhaps to even other diseases using the same care model. We'd like to thank you for your attention for our project, and we hope that you enjoyed the presentation. We are eager to answer your questions, and we remain readily available. Thank you.